Hello and welcome to this Q&A from the Fertility Alliance. Today we are being joined by Bassel Wattar and we're going to be discussing medical trials and people getting involved in them. And Bassel is an Associate Professor of Reproductive Medicine. So thank you for joining us today. The first question I wanted to ask you was about patient involvement in trials. Is that something that's always happened, or is it relatively recent that patients have been involved in planning of trials?
Sure. Thank you very much, Kate, for facilitating today's Q&A and for shedding light on this important element and all the great work that the Fertility Alliance is doing. So, for many years, we used to do research from the top down. So a cluster of researchers, of clinicians, will decide what's actually important, what is the gap, and they would go about, try to do research to answer these questions. While with all good intention, unfortunately, this often miss the objective, which is we really want to produce research to improve. To lead to a direct impact in patients' health. So this started let's call it a movement of patient and public involvement, what we colloquially call it in the UK. In other countries, it's called different. So, for example, in Australia, they call it lay consumer involvement. And that basically is all about asking the patients, what is the problem? What's the gap? What's the most important for you? And how can we really produce research that is relevant and can lead to a greater impact into your health and well-being? And that this is very relatively recent. So let's say 10 years. And I think the methodology on how to involve patients proactively in research is evolving, particularly around trials and other fields of research.
For you as a researcher, what do you think is the advantage of involving patients in the kind of early stages of your trials?
Several. So we had a lot of experience and expertise already in involving patients. So, for example, we are just wrapping up a project evaluating treatments for heavy periods, and when we involved women with lived experience, we have it's vastly enriched our experience and our understanding. Even for me as a gynecologist who looks after women with heavy periods, we learned amazing information about the process. But something very simple could be that how do you assess the volume of bleeding? And a lot of the women we spoke with who were advising us said, you know what, when a lot of the blood is lost in the toilet while you're sitting because you're having very heavy periods, and this is often misjudged when you are doing a proper research. So it's these sort of everyday really small events, but they're very enriching to the whole research project, and they really make the research project more focused on the true health needs of a patient. Is a fantastic experience to researchers and the lay representative involved in it.
And does that lay involvement carry on throughout the trial?
Ideally, yes. It should be even starting from the design stage, which is what we try to do in most of our trials that we run nowadays. We involve patient representative from the design to the concept to design of the protocol, and then throughout the conduct of the trial, where we can often have follow-up meetings with the lay representative telling us how is the trial going, how is the recruitment, maybe there are barriers that we're missing. So, for example, one time we were doing a trial on a Mediterranean diet and pregnancy, and during the month of Ramadan, a lot of women were fasting, and we missed that. So we spoke with the representative from a Bengali community, and we understood this barrier, and so we changed slightly the protocol around the Ramadan fasting, and that helped us a lot in increasing recruitment to the trial. So these kind of information are very important and has to continue throughout the cycle, all the way to even how do we actually publish the results? Because for many years, it was that we doctors are publishing results for doctors, but nowadays with the social media and all the other outlets, we're actually publishing results in lay language so that the patients can digest it and they can use it to inform their treatment choices.
What are the main kind of things that you ask patients to comment on?
It can range from very open comments. What do you think about that? Sometimes sometimes we're a bit more specific. So, for example, a very common and of high importance is which outcome should we actually report on? So, for example, in IVF, we often report on how things are changing in the lab. But you speak with patients and they tell you, you know what I care about is I want to go home with a healthy baby. So live birth becomes very important. So this outcome prioritization is very important. as I mentioned as well, is how do we assess the outcome and what could be potential barriers or facilitators for patients to involve and get enrolled into a trial. These are very, very important information.
And what are the specific roles that patients might play in a research project?
They could be co-applicants. So in a lot of our applications to national funders like the NIHR, and MRC, the funders proactively call for lay co-applicants to be part of the application in the investigation team because that helps to ground the research from the start. They can be advisors sitting on, for example, the steering committee of a trial, advising how on the trial conduct, and they could be also part of a lay group that is engaging in the throughout the trial activities and advising from day activity. And finally, a lot of our long-time lay collaborators that we still work with them for a long time, they serve as ambassadors, so they often get attached to the particular condition, like PCOS, for example. We work closely with several charities and they often serve as ambassadors for this particular condition and for the research that we're doing. So, and they help us in the dissemination in the community through lay channels like social media.
It sounds as if it can be quite a lot of work. Do patients get paid for doing this?
Largely speaking, yes. Obviously, not a huge amount, and research continues to be underfunded, I think. But most of the national funders, like NIHR, MRC, nowadays dedicate a specific budget to remunerate participants for their time advising research, and obviously that involves just hourly remuneration as well as travel costs and so on. So we try our best to say thank you for the time that they're spending with us on the research.
If you've inspired someone to think, oh, I'd quite like to get involved in that, what do they have to do? How do they go about it?
I would say reach out to particular charities, for example, Fertility Alliance, because often we as researchers lean on the charities to help us access to the like community of people with lived experience for a particular condition. This applies to, for example, heavy periods or polycystic ovaries or endometriosis UK. They're all fantastic charities doing a lot of work, and that can create a true partnership between the lay community and academic circles.
And finally, presumably it's not just the planning of the trials and the management of them that you want people to be involved with, but also quite often actually the trial itself, if you're testing something new. Would you encourage people to get involved in that way?
100%. We actually published evidence to show that taking part in a trial in itself, in whether you are in an active treatment or just a placebo arm, just taking part in a trial improves health outcome because you get more attention, you get more concurrent care provision, and strongly recommend every patient when they have the chance, if they feel this is for them, to take part with the trial. You get involved with a great team that is often very well organized and everything is ethically sound, and so it's a worthwhile experience. And most importantly, you're helping millions and millions of other people with the same condition to hopefully improve their health.
Basil, that's a very persuasive argument for taking part in trials and being involved. Thank you so much for joining us and for explaining a bit more about getting involved in research.
Thank you very much, and hoping for more research jointly in the future.